Good afternoon. I'm speaking to you live just outside.
I like to think balding is just God's way of saying, now let's see you get laid.
Is it true that if you don't use it, you lose it?
What I'd really like to do is put the greatness of this man in perspective.
The hairloss community has a lot to be thankful for, having you as a spokesperson.
You mean you just call this guy up?
About life and about reality.
Split screen.
And now, America's #1 reality radio show for men. Live from Los Angeles, it's Spencer Kobren's The Bald Truth.
What's happening, Jerry? You look like you were in a little panic there for a second. I was coming back.
I'm reading the article. I realized, wait, where'd he go? Where'd he go?
I'm right here. For crying
How you
out
doing, my
loud. I'm okay. Listen, I think we're going to do a new segment every week. We're going to call it Incel Mean Tweets of the Week.
Incel mean tweets.
Because I can tell you that I would say that the meanest fucking comments that I get about my person and my appearance comes from the incel community.
Speaking of which, you look damn good today. You look healthy. You look, I don't know, something. Did you get a haircut?
I didn't get a haircut, but I have not had a drink in a while. So I really think that that's probably it.
All right, that'll work.
Yeah.
That works.
I mean, I'm smoking like 2 packs of cigarettes today, but whatever. I'm just kidding. I don't smoke, people, and my insurance company. It's a joke. So, I'm doing my thing on Instagram, and things seem to be growing, which is great. A lot of positive stuff, positive comments. One guy writes, all this coming from a guy who's wearing a dead squirrel on his head. So I shoot back a comment saying, it's not dead, yo, and training this bitch is very difficult, or something like that.
Yeah. That's good.
And I decided to take a look at his profile. I'm like, it's another incel. No offense to the incels. I don't even know why you've chosen to be incels, but whatever it is, this person has been touched by a woman since he was last put in diapers.
Oh, jeez.
But it's interesting. Here's what's interesting. And listen, honestly, if I was gonna wear a squirrel on my head, do you think I would pay for this shit? You think I would walk around with the whole Trump the early years thing happening? Who the fuck buys a comb over toupee?
I can't answer that one. I don't know.
I think it's a good question.
It is a good question.
I didn't even think I could find one online. Maybe someone can make one for me. Anyway, guys, the phone number is 888-659-3727. I think I fixed my sound, by the way, Joe.
Oh, you did, actually. Yeah, I just noticed that.
I'm going to thank Suncast from the guys from Queens Network for showing me what a fucking, I got to stop cursing, what an idiot I am. I have to work on the not cursing because everyone's asking about the Maxim thing. We are going to be doing the Maxim thing, because of the Global Hair Loss Summit and some remnants of the pandemic and some stuff that they had to do and I had to do. We just never fully got it together. And I haven't gotten the article out that's going to be promoting this, which is also going to be talking about our Trusted Content Creator program. So all of you handful of trusted content creators out there who have not done shit with your distinction yet, it's probably time because this article is going to go out and you are going to want to be a part of it.
Yes, that would be a good idea.
The phone number is 888-659-3727. While Joseph talks about what he wants to talk about, I'm going to go in right now and try to embed Joe's channel onto the Bald Truth because I just got to the studio and have not had time to do that. And believe it or not, there are a bunch of people who, for whatever reason, still watch the show just on the Bald Truth.
hey, you can't knock loyalty, right? I mean, they're loyal to the brand, to that particular space on the interwebs.
I like
where
it,
they
but
get their stuff,
if I
man.
forget to embed your feed, which is the only place that I'm doing the live broadcast, the video broadcast, these people get mad at me, and all of a sudden I'm getting emails, which I don't read half the time.
Well, you're getting
to the Bald Truth, saying, why the F isn't the show on? And it's like, how many times do we got to tell you? Go to Joe Tillman's hair transplant channel at youtube.com/hair transplant mentor.
Good.
And subscribe. And then you won't have to worry about me doing the extra work.
Because they want you to do the work. Anyway,
so I'm going to put the camera on you for a second. You can talk to the people a little bit about what you wanted to talk about, and then we'll take some calls.
Yeah, well, it's I was actually trying to embed the web page into our streaming software so I could bring that up on screen, which I can do, but I can't scroll through the article. It's a new article or newish article on hair loss cure 2020. See, was it? Where is it? Yeah, hairlosscure2020.com. Our friend over there who is really on top of the non-surgical hair restoration or hair loss medication, we'll call that niche or field or genre or area of hair loss that we don't particularly deal with a whole lot on the show or on our respective platforms. But this guy, I won't reveal his name, but this guy is on top of things. We really appreciate his support. And I love his website. Like, it's really informative. So I do recommend that if any of you watching this or listening to us on podcast are interested in hair loss news, such as new treatments coming out, things like that, head over to hairlosscure2020.com. It's a great resource. But there's been a lot of buzz lately on a couple of different YouTube channels. I know Kevin Mann was talking about something like this. I don't think it was this exact same, it wasn't this same treatment, but the same basic treatment where androgen receptors are being targeted by the medication. In this case, it's a topical. And I got a little bit of interest in this myself. And if you are a subscriber to this channel or you've been following me online, you know that I never talk about this stuff because I think it is just a waste of time. I think, why put so much energy, much less debate into these issues, because these are things that don't exist. They're just in development and everything's always in phase 3 trials and we never see them come to fruition, blah, blah, blah. And that's dealing with FDA stuff. But, it's an interesting route to go around the FDA by creating a product that is more of a, what they call a cosmeceutical. In other words, it's a cosmetic treatment, not a medical treatment, even though they are using what you would imagine to be a medical approach. It's smart, but then again, is it smart for the consumer? Because things like this can have side effects. So anyway, that's a whole nother discussion. But my interest in this is because it is a different approach to dealing with hair loss that's not being a DHT inhibitor. It's not blocking that process of dihydrotestosterone being converted from testosterone via the 5-alpha reductase type 1 and or type 2 enzymes. So I've not jumped into this deeply. I've just kind of skimmed the subject because I've been really busy this week. But this is interesting because it says here in an article from February 22nd, just 2 days ago, Cosma RNA for sale at the end of March 2023. That's a month from now. We're currently in the end of February 2023, so this is coming out at the end of next month. And that was the first thing that really interested me about this. And it's going to be in Europe only for now. And just skimming this article, it talked about how it's a little bit easier to get into the cosmeceutical arena in Europe as opposed to other areas, and I understand that. But going through this, it's interesting. And again, I recommend that everyone after the show go read this on hairlosscure2020.com because it is a good read. But there's one thing
Tell
that
them the
I'm
truth,
always
Joe.
looking for.
Tell them the
Two
truth.
things, actually. Two things I'm always looking for. One, I'm looking for side effects. What are the side effects of any treatment coming out? And they're claiming no side effects. So
I'm going to interrupt you. If there are no side
That's a
effects,
bonus.
Seems like a bonus. If there are no side effects, I'm going to state that it's very possible there are zero effects. Just saying. Go ahead.
well, there is that. There is that. That's a great.
There's not
that's a good
there's
angle.
not a natural product in the world that comes from nature's pharmacy that has any effect on your body that cannot have a possible counter effect or a side effect if it is doing anything positive to your system.
And that's the thing is I do want to dive deeper into that. They said no side effects, but is that a contextual answer? No side effects, but something, or within certain parameters that they set that define what side effects are. Like you never know. Like it's always it's not what you say, it's how you say it. That's the old adage. So, but it's encouraging that what they're releasing as a product to deal with hair loss does not have side effects according to them. Of course, they have every reason to say that. It's only beneficial for them to say that, even if it's not entirely true, obviously. But the second thing I look at, and again, if you've been a follower of me for any amount of time, you know that the one thing that matters to me are the results. And I had to look at the results. And you can too, right here. So how does this look to you? These are photos of the test subjects. I forgot the number of test subjects. I think it was like in the high 40s of individuals, and half were the control group, half were the actual testing group. And you can see here, I don't know how clearly this comes across on screen, but from left to right, you got baseline, then 8 weeks, 16 weeks, and then 24 weeks, otherwise known as 6 months. So the top row of each section is the testing group, and then the bottom row of each grouping is the placebo. So what I'm seeing here, I'm seeing very little. I'm not seeing zero difference, zero improvement. I'm seeing very little improvement. And the two sections that I want to bring attention to is if you count down from the top row, there's 1, 2, 3, 4 rows down. It's simply the part line going down the middle of the scalp. I do see a difference at 6 months compared to baseline, but this is the kind of result that I'll notice in a good PRP session where everyone else is like, I don't see a difference. But what I see here is I see a difference in density where the part line is a bit more narrow. But to be honest with you, this could be simply due to cycling of hair growth or hair growth cycling, through the year. It's 6 months later. It's such a minor difference that I don't know if the treatment can actually be credited for this minor improvement. The one above that, 3 rows down, I do see a little bit of a difference at the very front of the scalp, which is at the bottom of the image. It does look a little bit thicker. And then the shaved areas I think are interesting. At 6 months, on the top row of the test subject, it looks like it's more dense. It looks like it's an improvement. But what you'll also notice is that the area that they shaved down around the dot that was tattooed on the scalp, they shaved out a smaller area. At first, it looks like, oh, holy shit. It thickened by becoming smaller. Well, the area's not bald. They shaved this out to show the density where they're actually counting, and it doesn't look any different to me. They may have counted the follicles or the hairs growing. There may be some improvement, but I just don't see it visually, and that's what matters. So ultimately, I'm not being down on this treatment. I am being realistic on this treatment because, as Hair Loss Cure 2020 in the chat room, thanks for joining us, says it's supposed to be comparable to finasteride. I don't see a finasteride comparison here. It just in the images alone, I don't see a legitimate finasteride comparison here. I think that finasteride would be more effective. Now, does this mean that people should ignore this or not give it a shot? Absolutely not. If it does work for some people in the way that finasteride can work, where it is arresting hair loss, which to me is the main benefit of finasteride, is arresting hair loss, not so much getting some sort of improvement, like a visual improvement. If you get that, that's bonus. But if you can maintain and then have the stated no side effects, then that is a huge win. That's where I see the potential in something like this. So when treatments come out that make some sort of bold claim, I look for, I usually see it coming into the middle ground of where it's not quite as good as what they say it is, but it might not be a complete failure, so it's somewhere in between. I think that that's what this might wind up being. This is very preliminary. We don't know long term. We don't know what it could look like on a more massive scale, the macro level of how this can affect hair loss sufferers. But potentially, there's hope where it can be better than finasteride for some people that are sensitive to finasteride. Even those people that are taking topical finasteride and are experiencing side effects. And so that's basically my take on this. I think that it is potentially a new treatment that's worth considering. I think that people should be tuning in to hairlosscure2020.com for updates and to see how this unfolds. And I'm sure you'll be seeing this in other platforms as well, but I think that hairlosscure2020.com is the definitive resource to stay on top of this. So that's today's news, or this week's news on hair loss treatments. And,
now, I have a question for you, Joseph.
On it.
How do you feel about the concept of this company deciding to go and promoting this and getting it on the market as a cosmeceutical, as opposed to following through with their initial efforts to start doing phase trials and possibly getting it FDA approved as a drug? Now, I understand that there's cost involved. And I understand that there are certain limitations involved. I also understand it's a hell of a lot easier, not just in Europe, but also here in the United States, to have a hair loss product, whether it's an effective product or not, to be pushed through as a cosmetic as opposed to a drug. Now,
I think that's a great question.
Yeah.
And I think that if, just off the top of my head, I think that if a company is serious about being or they want to be taken seriously as a hair loss treatment, they should go through the trial by fire. And if the product is as good as they being anyone that is going the cosmeceutical route, if it's as good as they say it is, then there should be no problem getting the funding to actually make it through FDA trials to get that ultimate stamp of approval to say we are not FDA cleared, like some device that is no different than something made 60 years before it, but we actually got the stamp of approval by the FDA.
But that
is the greatest marketing label that anyone could have on their product.
But I think people have to understand what the limited standards, which are basically none, to be in the supplement category here in the U.S. and abroad, and to be in the cosmetic category, it's barely anything.
Yeah.
So you and I could put together some bullshit. We could have it made by a third party, as long as the ingredients are essentially okay to market and to be used on humans. We can say whatever the fuck we want and just have a little disclaimer on the bottom. These claims have not been, approved or substantiated by the FDA or whatever body that they are working with in Europe.
Yeah.
So I'm not saying this stuff doesn't work. I will tell you this: they have not contacted the American Hair Loss Association throughout any of the process, and at least 7 out of 10 products do, which do not come to market. So to me, if this was something, and there are some doctors even talking about it in chat groups, and another doctor saying, well, this seems like something very similar to another product that was put out not too long ago. They would normally contact us to, at the very least, either give us an embargoed press release about the product, want to get involved with us in some degree, want to get our seal, or at the very least, let us know so that I can let the public know. That has happened maybe 6 times in the last 20 years of the American Hair Loss Association. So
That says a lot.
I'm not poo-pooing it. I'm just saying, before you go out there and spend your money and possibly waste your time, let everyone else on the message forums do it. Let's see how they do. Give it a year before they give up on it. Or give them a year before they can say, this shit is working. I can't take finasteride. This has been helping me out.
See, everyone, I was the one that kind of positive about this. Spencer's the negative Nelly here.
Not
me.
negative. Not negative. Not negative. And for all you incels out there, don't shoot the messenger.
All you incels, Jesus Christ.
I want this to work. Trust me. There's a lot of people, women especially, who have androgenetic alopecia who cannot, they don't do well on finasteride. They're forced to take, or they're told to take, low androgen index birth control, spironolactone, now oral minoxidil. If there was something that could actually essentially stop DHT in its tracks topically with no adverse side effects for women, it would be a fucking miracle. I would be all over it. I would be pimping it out for this company. And maybe that'll happen. I hope it does.
Yeah.
Anyway, guys, 888-659-3727. That's 888-659-3727. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from?
Hey, guys, it's Morty from Brooklyn.
Hey, Morty.
Hello, Morty from Brooklyn.
How's it going? Hey, guys.
Pretty
Yeah,
good.
man,
Pretty
well,
good. What's going on, buddy?
Yeah. Well, thank you for letting me be the first call. I got some rather disconcerting news about a week ago, and it's only marginally related to hair, but I figured I should bring it to your attention. So, went in for my annual physical, and they did a blood draw and they did urinalysis. And the blood draw surprisingly showed that I was anemic, which is surprising for me. I've never been anemic before in my life. The urinalysis showed that I had occult blood in my urine. And, I didn't really think too much of it. As you know, I'm good friends with a doctor, which everyone knows, my good friend, Dr. John Cole. And I happened to mention it to him last weekend. And he basically said, you have to make sure that you don't have any tumors. And, of course, that just freaking threw me for a loop. Spencer, you're like me. You're very sensitive about your health. So that it sent me spinning.
I don't know if I'm quite like you, but I definitely try to take care of myself.
Yeah. So I then went and, I was a bit nervous. And, of course, I hit the Googles. And one of the things that it says about occult blood in urine is that it could be the result of what's called abnormal structures within the urinary tract.
Yeah.
And that translates into things like bladder cancer or prostate cancer or potentially kidney cancer or, testicular cancer, all kinds of lovely things like that.
Yeah.
You combine that.
Or it could be nothing really. And it could be transient.
Well, that's why the doctor said, go get another urinalysis, which I did. And the second urinalysis still showed that I had occult bleeding. And so now I'm even more nervous. And then, of course, with our lovely medical system that we have in this country of ours, I can't get a fucking urologist appointment, excuse my language, for another 2 months, which, of course, is making me just...
What kind of fucking insurance do you have?
Crazy. I have Blue Cross Blue Shield. And it's not even insurance. It's the fact that, I must have made 5 different phone calls, and all of the freaking phone calls land me at the same, Neuropresbyterian urology department. Even though they have 5 different clinics, it's all the same urology department.
Well, what about something simple like instead of going to Google or instead of going to WebMD, who I write for, by the way, but there's still some, still kind of scary shit when you go on there. You know, maybe it's a slight urinary tract infection that you're not necessarily suffering from yet. You know?
Yeah.
There's
Well, I mean,
go ahead.
Yeah. Yeah. So, I mean, so that was one of the things that, and the urinalysis said it was negative for bacteria.
Yeah.
And it was negative for any, and they're typically, I don't have the record in front of me right now, but basically it said that there was no obvious UTI type of deal going on. So all I really want to do is I want to get a freaking urologist to check me out. I mean, it could, you know, there's no sign of that. There's no sign of it's kidney stone related because there's no calcium in the urine, all this type of stuff. So, anyway, I mean, the only reason it's marginally related to hair is because of the fact that I'm on finasteride, and you know, and B, you know, one of the possible things is, you know, a couplet could be a sign of prostate cancer, which, you know, is related to finasteride, at least in some very small measure. So, yeah, that's why I called.
So what about take the finasteride off the table? And when you say that it's related to prostate cancer in some very small, what'd you say?
Yeah, well, there's at least some very small evidence that for certain people, finasteride can hide the possibility of prostate cancer because of the PSA numbers that it plays with.
Well, actually, what the study, and there were several studies. First, there was a study that was basically blown out of the water. The study stated, scared a lot of people, that in people who were taking finasteride, if they did present with prostate cancer, that it was a much more aggressive form of prostate cancer. And then what they found out after doing other studies was that because I guess it could be more difficult to detect in some people.
Yes.
But it's not necessarily because of the PSA, because the PSA should, anyone who's on finasteride, the PSAs should be doubled when you're on finasteride. So if you are averaging a 1, it's doubled to a 2. Not necessarily saying that it is a 2. I don't know. I'm not going to say it can't be finasteride, but I hate to break the news to you, Morty, but you're old.
Yeah, no shit.
You know?
Exactly.
I'm not sure if anyone's told you lately, but you're over 50.
Yep.
You know? So shit happens.
Yeah, man.
You know, and it could just be a hemoglobin issue, for instance. I'm not a doctor. I'm not playing one. But it could just be that your red blood cells are breaking down differently than normal, which may not actually cause you any long-term adverse events, except for a little of the occult bleeding in your urine. Don't go straight for the kidney cancer or straight for the prostate cancer. That's all I'm saying.
Well, and a number of my friends have basically told me don't freak out about it. It's just, like I said, the annoying thing about this whole process is just how slow our medical system is. And I don't just mean here in the States. I mean generally. You know, I had a good friend of mine. He's no longer with us. My good friend Dominic, who went to his doctor for a stomach ache. And this is in England where they have, you know, socialized medicine. Doctor started out by giving him antacids.
Sure. They let you die in Europe, man. Forget about it. You're a dead man.
Yeah. He basically, until he was able to get to a doctor to diagnose his stomach cancer, it was like 4 or 5 months.
Yeah.
And when they finally diagnosed him, it's like, oh, it's too late. You know, you should have caught it, you know, 2-3 months ago.
Yeah.
And I'm like, wow. You know, and then I try to get a freaking appointment with a urologist. It's like, oh, we don't have openings until May. I'm like, are you fucking kidding me? They're like, well, you could try calling in every day to see if somebody drops and you can get their spot. I'm like, are you fucking kidding me, man? Crazy.
Yeah.
You know?
No, look, that's just medicine. Like never expect to be impressed by medicine. So what I would do,
I'm gonna interrupt you right now.
I would place calls all over the area, not deal with just you said 5 calls led you back to Presbyterian. Yeah. Well, they're not the only game in town. They're only game in the state or in the Northeast. Like I'd pay out of pocket, hop a plane. I don't give a shit. I don't give a good gosh darn.
That's actually good advice. Dr. Richard Chaffoo is actually texting me. I guess he's trying to get in, and he said to tell the caller to make sure just to go to your primary care doc. He needs a workup now, not in 2 months. Bladder cancer, renal cancer possibly. Prostate cancer is unlikely.
First of all, thank you, Dr. Chefu, because there's a really good doctor who's going to come out and just take a risk on passing along medical advice to say that to me, and that just tells me, yes, I do not want to wait 2 months to see a freaking urologist. I need to discount these things immediately. And so I've got to call into and that's another thing. I called my GP, and he's been dragging his feet also to even get back to me. So it's like it's one thing after another. These guys, like I said, I hear from my GP once a year.
You can go into your fucking pocket, man. You can pay for these tests. It's not going to cost you a fucking fortune to see a doctor and ask for this blood work.
No, I'm going to definitely do that. I'm going to I just have to get somebody to write me a prescription for the appropriate test because I have no idea what they are. So,
So he just said he shouldn't wait 2 months. Go to your nearest medical center, ER, and complain of abdominal pain. He might get a urology consult sooner.
Mm-hmm. Okay, that was the other step. It's a lot of my friends says, if you're freaking out, go to the freaking ER. I'm like, okay,
Yeah, but you got to complain about something. You got to say, listen, I have this pain. I've had occult blood in my urine. Now I'm having this abdominal pain. What the fuck is going on?
Yep. Let me just do that tomorrow. We shall see. Well, anyway, thank you for calming a potential hypochondriac, but somebody who is always very sensitive about their health, and I do appreciate it, because the last thing I need is to have to do a round of chemo and then lose all this lovely work I have on top of my head. So,
exactly.
That is true, but fingers crossed. That maybe it's just, kidney disease. I'm just kidding. Fingers crossed that everything is okay.
I'm hoping for a freaking kidney stone, That's what I'm hoping for. Just like, okay, fine. I got to go through that sort of pain, although I've heard it's pretty horrifying, so I don't want to do that either, but,
Dude, everything's horrifying. Once you get to my age, man, everything's horrifying.
It's like he's the only person that's 57 on this planet. It's like, once you get to my age.
Dude, somehow I'm still holding on. I don't know what's going on, but I'm not going to get into the story because we're talking about something serious with Morty here. But Morty, listen, I know Dr. Chefu is trying to get on. When he does get on, and I'm going to tell him, Doc, call in like 30 seconds. I'm going to drop Morty, and maybe you can get in. Hopefully, he can comment on that, and also whatever else he wants to talk about. All right.
I hear you. All right, guys. Appreciate the sympathetic ear as always. Love you guys. Keep doing what you're doing.
Morty, Joe will be praying.
Thanks,
for you.
Morty.
All right, guys. I'll talk to you soon.
You'll be okay. Hang in there.
I will.
All right. Take care.
Bye.
We have a line open, 888-659-3727 if you want to call in. Dr. Chefu, try to call in because the line is open, 888-659-3727. In the meantime, we'll take this call. Hey, you're on the air. Who's this and where are you calling from?
This is Dan from Vermont.
Dan, how are you, man?
Good. How are you guys doing?
Okay.
Good, Dan.
Awesome. Just a quick question for you guys. I don't know if this is stupid or not.
I will.
So, been on finasteride and oral minoxidil for like 6 years now. Hair has been steadily going throughout that process. I've tried different dosages, tried dutasteride, tried basically everything. Just wondering, like, I'm moving into a Norwood 3. I know that I'm eventually going to want a transplant. Is it ridiculous for me to be even considering that when I know that I'm going to continue progressing throughout the rest of my life, likely?
Great question. How old are you?
35.
35. Before I answer that question, let me ask you this. Your finasteride or intake, generic or name brand, Proscar or Propecia?
Tried both. Tried it both ways. Been listening to you guys for a long time. Essentially, I've tried all of your guys' advices and tips on this.
Okay. And how long did you wait in between switching things up? Like, you'd be on generic for how long? You'd be on name brand for how long? And how long did it take for you to switch over to finasteride?
About 8 months. I would usually wait to rotate between them.
Okay. What was the longest you stayed on any one single treatment?
I've been on finasteride now for a couple of years just because I'm paranoid in case it helps at all.
Sorry. Let me rephrase that. What's the longest amount of time you've been on one single form of finasteride, being name brand or generic?
1 year each way.
Okay. Well, you just said 8 months.
1 year for name, 1 year for name brand, and then multiple years for generic.
Okay. All right. If it were me, before I pulled the trigger on surgery, I would go back to the basics of what we know is not an imitation. I would go back to a name brand. I would get ProScar. If you're sticking with finasteride, I would go to ProScar just because it's cheaper. If you're on dutasteride, I would go to name brand Avodart just to eliminate that question of generic being as effective as name brand. Stick with that and do not change. Do not go to generic. Do not do anything because you don't want that question mark. If that progression does return or if it does continue, you at least know that you're doing everything right as far as your medical treatment. To your question, does it make sense to have surgery? Well, you're 35 and you're not a Norwood 3. You said you're moving into Norwood 3. Is that correct?
Yeah, I'm just about there.
Okay. And what's your family history of hair loss on your father's side and your mother's side as far as the men in her family?
They great hair when they were young, lost it when they were old.
Define old. 50, 60?
Like 40s, yeah, 40s to mid 40s, throughout the 40s. That would go.
No. That's going to leave a mark.
No, that's see. Now you put us in the wrong side.
40s.
He's 35 years old, and he says old is in the 40s. Okay, all right, fair enough. And which side of the family was losing hair? Is it both or just one side?
Both different patterns.
Okay. Well, let's dig into that. Patterns on which side? What's the patterns on your mom's side, and what's the patterns on your dad's side? And is it consistent?
Diffuse on one side, and then just traditional thinning of the temples, and then the hairline starts to go, and it all starts to recede back.
I mean, how far?
Like the first half of the head.
Give me some Norwood levels here. What Norwood levels are typical on your mother's side and your father's side?
4, 5 on dad's. Basically, same on.
Carl, you have to be very specific with Joseph.
Yes, because if you're not, I'll tell you.
It's like
in order for him to help you.
It's like 4 on dad's, like 5 on mom's.
Okay, all right. So so you don't have any 6s, you don't have any 7s, and it doesn't happen early in life. It happens later in life.
Right.
Okay. Well, the ultimate answer to your question depends on you and your characteristics specifically as far as your donor area, basically. Everything ultimately depends on the donor area. Everything else I was just asking about you, those are important questions. Those are important things to be aware of and to consider. But it does depend on your donor area. So I think that being 35 and let's assume that you try every permutation of hair loss treatment that's out there, and it does continue. And I'm pretty sure I can assume safely that it is a slow progression because you're 35 and you're not a Norwood 3 yet. So that's what I would define as a slow progression. I think that if it were me, knowing what I know, I would not get surgery until I find that balance. I'm a big believer in arresting the loss before you get yourself cut, because you don't want to look back 10 years from now and have a progression of loss to where that you can't address because lack of donor, lack of funds, knowing that you didn't try everything, and stick with it for enough time for it to actually do something for you. From what you've told me, it sounds like, yeah, you've tried different variations of finasteride and dutasteride, but you haven't stuck with one variation of that for the long term. Because the reason why that's important is because finasteride, as an example, you don't get the full effects after 1 year. The studies were showing that it takes up to 2 years for the efficacy to peak. So you could have still seen some sort of improvement to where it slowed or stopped your loss up to 2 years after taking it. And it sounds like you switched things out before you reached that point.
I would say maybe not on the name brand side, but on the generic side, I've definitely been on for multiple years.
Right, and that's why I was saying, okay, and that actually reinforces what I was saying. Get back to name brand. Go to ProScar because it is more affordable when you cut it into quarters or however whatever dosage your doctor was prescribing for you. But when you're on that for the long term, then you know whether it's truly working for you or not truly working for you, or barely working for you to where it may be slowing the loss but not stopping the loss, and not reversing it on any level. I feel that just based on what you've been telling me, you've been a little too quick to jump the gun on changing things out because you weren't, and this isn't specific to you. Like a lot of guys do this. They don't see anything after a year, so they try something new. I understand that, but I think maybe you jumped the gun a little too early on that one. That's my gut on this, and that's the way I would look at it if I were looking at having surgery myself. Again, knowing what I know about this industry, try the medication, name brand, give it the time it deserves to do what it's going to do, and reevaluate. I really think that that's the best thing for you because you're unsure about things right now, and I don't want you to make a move that you might regret. I think that surgery, if properly planned, again, if you have sufficient donor, would not be a terrible idea, but I think it would be a bad idea before you get a handle on your hair loss as far as the medical options, without truly exploring what all your medical options can present or do for you, if that makes sense. That's the way I feel about it. Don't do surgery yet. Continue with the medical therapy, trying to find that balance before you pull that trigger.
I think that's very sage advice.
One last question, I'll let you guys go. Does it ever slow down with age? Like, does it ever the progression? Like, does it ever like hit a point where it like just kind of like stops, or is it once it starts, it's a never-ending fire?
That's actually a really good question because sometimes it can.
It is,
and it really does depend on your testosterone levels as it pertains to the conversion of testosterone to DHT. With that said, even with older guys who have lower testosterone levels, where you would think their DHT would be lower, and again, we're not doctors, just based on their age, there is something called, they used to call it senile alopecia, but aged alopecia, where the hair shaft diameter just gets smaller, and you do notice an overall thinning, but not necessarily. You're not necessarily going to experience the balding process in the same way as if your testosterone was at normal to high, higher or to normal levels. So to answer your question, in short, yes, it can slow down as you get older in some cases, especially for the guys who started early. That just seems to be a trend. I don't know if that is a medical fact, but it's definitely something that we see and that I've seen over the last 25 or 26 years in the field.
Not to mention the fact that you basically answered your own question where you said that no one in your family has gone beyond a 4 or a 5 on the Norwood scale. So, yeah, it does stop. And that's one thing I think is encouraging. If you're following that pattern that you're seeing with male members of your family on both sides, then if you have an average donor area, then you probably have enough donor hair for the future to cover these areas. But you don't know if you'll have the financial availability or ability to deal with that. As I don't talk about enough. Like, we never know our financial future. Like, it's something we need to also keep in mind. But I think that you did answer your question, because you haven't seen 6s and 7s in your family. So it doesn't mean that you won't go there, but I think that the likelihood of that happening is greatly reduced because no one else in your family has gone there. It's not a, it's not an exact science by any stretch, but I think it is a fairly good indicator based on what you're telling me. So, yeah, it's not dire for you. Like, it could work out quite well, but just stick with the medical therapy first. Find that balance. Find something that can make you feel better about it, and reevaluate.
All right, man. Listen, I hope we were able to help you. We're going to take another call.
Sure.
All right. Good luck. Hang in there.
Thanks for calling.
I think this is Dr. Richard Chafu. Wait a second. Of course, there's 2 of the exact same area codes in the line. I think this is him. Hold on. Hey, is this you, Doc?
This is me. Hey, Spencer. Hey, Joe.
How are you, man?
Hey, Dr.
I'm
Chafu,
doing
how are you?
great.
I apologize for
I'm
you
doing
having
well.
to wait, but this is a busy show. What am I going to say?
I like that. No, it's a good thing. It's a good thing. I'm sorry for I got a little laryngitis here, so my voice is a little raspy.
You sound fine. So
no
let's
worries.
comment on Morty's call, the guy with the occult blood in his urine.
Okay. First of all, you don't wait 2 months for an appointment with a urologist, because the things I worry about, like bladder cancer, renal carcinoma, unlikely prostate, but he needs a cystoscopy. He needs maybe an IVP examination or an MRI scan. I mean, the things for him, I would say, is get in to see your primary care. Don't wait for an insurance company, because their job is to punt and, not get you in when you need to get in. So I would say that would be the first thing. And I think, like you said, Spencer, I mean, look, worst case scenario, pay for those things out of pocket. It sounds heinous. We all pay high premiums, but I mean, early diagnosis and treatment is the key in all these sorts of things. And occult blood in a male, otherwise healthy male, is a red flag. So it may not be anything, but it may be something. It's better to get in and get evaluated.
But isn't it? And just to ease Morty's mind, because I'm sure he's listening. From what I understand, between about 1/3 and a half of people who have occult blood in the urine, they never really find out why, which is kind of a good thing in a way.
Yeah, I mean, the thing is, I'm not a urologist by training, so it's hard for me to give statistics. But
Right.
I think an ounce of prevention, is the key for him.
100%.
So I don't mean to alarm him, but otherwise, a healthy guy with occult blood, you definitely want to work that up. The other interesting thing I wanted to comment on regarding finasteride, I'm amazed when I see patients for hair loss, how many patients have been told by somebody else, either you don't need finasteride, don't take it, or stop it. In fact, I saw a patient just the other day who came in for mid-40s, his Honor was for, nice guy, very healthy, came in to see me, for options. And so, I asked him about finasteride. I said, well, yeah, no, I went to another clinic and they told me, we want to do a hair transplant on you, of course. And, we recommend you stop the finasteride so we can figure out how much your loss is going to be before we do a transplant. And I said,
you are kidding me.
You want to stop? No, seriously. You want to do what? And you want to stop the finasteride? I said, why? So you could do more grafts? I mean, give me a break.
But was this a U.S.-based clinic?
Yes, in my city in San Diego.
Was it a chain clinic?
No.
Okay.
I mean, that's happening. You'd expect that in a chain clinic anyway, right?
Yeah.
They're all consultants.
Well, I know that for years, especially
record.
when finasteride first came out. I mean, one of the main chain clinics, they had on their website essentially that not to take this drug. That they were unwilling to promote this at the time. What was a miracle drug, where it really gave people a fighting chance to maintain a lot of hair. This company didn't want that to be the case.
No, of course not. Well, I mean, it's all financially driven. I mean, it's unfortunate that patients.
Do you have another kid, Doc? How many is this? Like 10?
Oh, I last counted. I have 7 kids, so a little one has got a little bit of what I've got right now. So you may hear her coughing a little bit in the background.
Sorry.
Yeah. So I mean, but that's just my intake on it. I mean, it's interesting. I mean, I take finasteride. I kind of like I know it's 3 just in the crown area. But there's no way I would get off of it. And I think the key is that I think like Joe said, you patients really need to maximize medical therapy. I have patients who will come and say, "Look, I want to do a transplant because I don't want to take that pill anymore." And so I tell them, "Look, we need to have a different conversation. Okay, hair transplant is not going to keep you from needing medical therapy. If anything, you need to continue medical therapy because you have a limited donor area, which everybody does, and at some point, you're going to be in trouble if you come off of it. You're going to run out of donor area.
Especially when you're doing FUE, and everyone now, the market is really about all FUE. And I mean, you've been doing this for a while now. You know that it's not the way that it was back in the day when docs were doing mostly strip, where you knew if you took a strip out of the sweet spot, there's a much greater chance that hair would be more DHT resistant for a longer period of time. When you're doing FUE and you're moving it from all over the back and the sides of the scalp, there's a greater chance that some of the hair that's being moved is going to be less DHT resistant, and medication is absolutely needed in order to maintain that transplant.
You're absolutely right. And part of this, too, is, some of these clinics that advertise these 4,000 and 5,000 graft FUE sessions, I just kind of scratch my head. I'm like, well, look, Walter Unger figured this out in the 60s of a safe zone. And you can't tell me you can take 4, 5, 6,000 follicles out, but guess what? Probably half of those are undergo miniaturization at some point in your lifetime.
Listen, 100%. You know the crap, and I'm trying not to curse because we're going to be doing more mainstream stuff, so I'm practicing. But the crap that I get from just putting some posts on Instagram about the reality of these young guys having these large FUE sessions and not being told. It's one thing if they're told, listen, maybe you get a good 5 years out of this or 10 years out of this, but at the very least, you need to be on medication because we moved hair from above, below, and to the side of what is known as a safe zone. So there's a good chance you're going to lose that hair. And it could be within a couple of years if they're not on medication. These kids are so hostile when they read this because they somehow think, like, what's my angle? Why would I tell them this? They already went through the surgery. And I'm just trying to warn, especially for the newer consumers, the guys who are looking at these so-called influencers who are getting these large procedures. I want them to know, listen, they may look good today, but in 5 years, they could be effed completely.
Yeah,
they didn't even know what's
seen that. You're right, Spencer. I had a patient not that long ago that came in to see me. A guy in he was like 19 or 20, and so I was just getting his history. And he said, "I've already had a hair transplant. I'm here for my second one." I'm like, "What?" I said, "How old were you when you had your first transplant?" He said, 17.
Oh my God!
I said, 17 from a very, very famous international chain. I don't need to say any more than that.
No.
And it was just, it just broke my heart, and I just thought, wow. In the end, you got to do the right thing for the patient. So.
Well, I mean, you do, but the problem that we have now is there's a handful of guys out there who are either in the IHS or associate members of the IHS, or even some of the guys who haven't applied who are pretty ethical. They're doing their thing. But I'm talking about a handful. If there are 150 throughout the world who really know what they're doing and how to advise patients, that's a lot. And we're talking out of thousands now who are hanging up a shingle and calling themselves hair transplant specialists. And what you're seeing online is ridiculous. It is it is complete, utter, I would say it's tantamount to malpractice. You talk about medical misinformation on the internet. This is the industry where all the medical misinformation, a lot of it, really, comes from, and the internet doesn't seem to care about that. They let it ride.
No. Look at the social influencers. I mean, people respond to people that know medical background that have their own, they have their own agendas to push.
It's 100%. Even those who have a medical background. I have some of your colleagues. You are. And just in case people don't know about Dr. Richard Chafu, he is a board-certified plastic surgeon. He's also board-certified in facial plastic and reconstructive surgery. So that's pretty unusual that you went that far. You went to school longer than I mean, how many years did you go to school? It had to be forget about
After medical school was
school.
9 years.
9
9
years.
years of post-surgical training. Right.
Okay, so you have some of your colleagues, mostly in the facial plastic realm, who are out there online, and they are, putting like a background of George Clooney, for instance, and saying, talking about his potential hairline or what the doctor, who's trying to be an influencer, by the way, thinks that George Clooney may have done to save his hair. And they are just spewing, in my view, complete bullshit. First of all, this doctor has no idea what George Clooney did or didn't do for his hair loss. In many cases, I see, especially this one particular doctor, just using celebrities and exploiting them to get clicks and to make consumers believe that he is an expert in this field. This guy just bought a turnkey device, in my view, does not know shit. Excuse me, Joe, I cursed again. Does not know anything about
You're doing better, Spencer.
about this hair loss situation, about the industry, and about the nuances of hair transplant surgery. Yet, I guess he invested in one of these machines, and he's trying to pimp himself out as an expert in the field. But he does have the facial plastic surgery credential. So what do you think about those guys?
I mean, I think it's a shame because I think that, for those of us that are across specialties, I mean, I happen to be a plastic surgeon, but that's just my background training. I have a love and a passion for hair restoration, but there are definitely people that just see it as a side gig. This is a side hustle. I'm going to get people in here just kind of do it, and I'm going to get patients to come in. We're just going to do as many grafts as we can, and it's a shame because it's a very nuanced, very complicated field. It's not plug and play, and just because you get a machine does not make you an expert. It can make you dangerous. So I think for any,
that's actually well said.
They need to have people. They need to. People need to be honest and say, well, this is. I think you're. I mean, I turn a lot of people away from surgery. Either they're too young and they're not ready for it, or they're too far advanced. Norwood 6, Norwood 7s, and they've been to other clinics and told, we could do 2,000 grafts. They're in Norwood 7. What are they going to look like? It's kind of a little island of hair. It's going to look ridiculous.
Yeah.
No one wants to look like that. People.
Well, one thing you're talking about, Doc, and I appreciate your input on this, but I've noticed, you're talking about how, and like Spencer said, that was very well said. It doesn't make them an expert; it makes them dangerous. I think one of the things that's a problem with some of the work that's being done and some of the doctors that are pushing this, it's not that they don't. It's not that they know that they're doing bad work and they're pushing these bad decisions on patients. I honestly think that a lot of these doctors think that they are doing a good job and they're doing a favor for their patients. And I think that because when you look at the greater expectations that patients have based on social media and all these influencers, the pool of layman knowledge in the wild has dropped dramatically when it comes to people doing their research. Their expectations have lowered. The golden age, as I put it, of hair restoration, where you had, ratio-wise speaking, a greater number of clinics doing really nice work. That's gone.
We really changed the game for a while, Joe, didn't we? We really made it a much safer place.
We really did. We really
now
did.
It's all effed up again.
But now I think that the way that these doctors are trained, even if they, we're just talking about the doctors. We're not talking about technicians. We're not talking about these rogue clinics or whatever you want to call them. But these doctors that are being trained on how to use these devices. This is the standard that they're taught by these device makers or by these trainers that are working for the device makers. So they honestly think that they are doing a good job. Even if it doesn't look fantastic, their expectations are based on what they're taught, not on what they're seeing with their own eyes. And I think that there's a very strong correlation with how patients are looking at this as well. For the patients, a lot of the times now, these multi-hair pluggy hairlines that are misangled, misdirected, it's just like in the 70s and 80s when you'd have a 4 millimeter plug hairline and the patient's just happy to have some hair. Like, I can't count how many times I heard that, where a patient was saying to me, yeah, when I got this done 20 years ago, being back in the early 2000s, yeah, I was bald as hell. I was just happy to have some hair. I didn't realize. Now I do, because I did some research after surgery, which is way too common. But I think that's part of the problem that no one's talking about, is that the doctor's own expectations are low because their own education was so poor. They don't know what's better. They don't know what you don't know. They don't know. Yeah, exactly. You don't know what you don't know, and I think that's a part of the problem with the industry overall right now.
And I think, as a surgeon, you have to be really honest with yourself and critical with your own results. Nobody hits it out of the ballpark every time. And when you don't get a good outcome, you need to sit back and say, gee, how could I have done this better? Sometimes it's a mistake you've made. Sometimes it's the anatomy. It could be a number of factors, but it's just being realistic in terms of how, thank you, of how, how you draw hairlines. Patients always want the hairlines down like they're Neanderthal. I'm like, we're not doing this. There's good news and bad news to hair restoration. The good news is it's permanent. The bad news is it's permanent. Right. So, I mean, it's like, I've said that before, but once you educate, you show a patient I want your hairline I don't want it to look ridiculous when you're 50. It needs to look imperceptible. It needs to look natural. It needs to fit your face. It's framing your face. Your eyes shouldn't draw attention to it. It's like a poor rhinoplasty. We all saw Michael Jackson. I don't know how many rhinoplasties he had. He had his first one. It looked great. It's after 4 or 5 people had gotten to him, it looked a little bit different. So, it's the same thing with hair restoration. You can always lower a hairline, but you can never raise it. So
and here's the thing.
I'll be on the conservative side.
Those are salient points, and they're very important points. But when you tell a 27-year-old or 28-year-old that you don't want them to look foolish when they're 50, they're thinking, I don't want to have this high hairline, and they may end up going to somebody else who will absolutely do it. And that's the problem. There is no true standard of care across the board in this field.
And I think your points are well made about finasteride. I'm always amazed at the number of patients that I see where no one has had a conversation with them about medical treatment. And it's a lifetime problem, and it's somewhat unpredictable.
That's right.
Even if we know that, one side of the family is a Norwood 5 and the other is a Norwood 4, hey, they could still be a Norwood 6.
Well, you saw what I posted. Sure? You commented what I posted in the doctor's group. Yeah. And it was just a comment, and this is a guy who I think he meant well, but he's a salesperson or a patient consultant, in quotes, for a pretty well-known Australian clinic. And he was pretty adamant about, thinking that, well, you can tell, or a good clinic can tell how far a patient's going to progress just by looking at their donor area. I mean, just by eyeballing. Yeah. And that's ridiculous.
I wish I could predict things that well. I would have won the lottery by now.
Absolutely. I'm like, how? And I made the analogy. How are you going to build a strong deck? You can't just eyeball how much wood is hanging out in the corner. You got to see how much rot is in that wood, or if any of the wood has rot in it, because you got to throw that wood out. And for some reason, this is not. I mean, some of the best known clinics in the world still don't even use densitometry to check out for miniaturization. Right. It's amazing to me. But Doc, listen, we can keep you all night. It's really a pleasure. I love having a true professional calling in. Is there anything else you want to add before we let you go?
No, just thanks for all the work that you guys do. Just keep doing it, educating and informing patients. I think that's what it's all about.
Okay, and thank you for commenting on Morty's concerns. I think you're 100% right. And hearing from a doctor to go and get him checked out.
I may be the only one sometimes to respond. I'm sure other people are thinking the same thing, but some of your comments I can't help but respond to. They're very poignant, especially the comment that you made about the clinic.
Well, I appreciate that. And yes, I mean, I said, I'm used to the apathy in this field. It's just the way that it is,
I can see. No, it's a great field, though. It's exciting, and it's good. It's really great to make people feel good about themselves. I mean, male hair loss is a huge problem. It's really how we identify ourselves. It's our self-confidence. It's a lot. And if it's not handled properly, it can be devastating.
Absolutely. Well said, Doc. Listen,
100%.
thank you so much for the call.
You bet. Gus, take care.
Take
Have
care.
a great
Bye-bye.
weekend.
Take care.
Again, bye.
Bye.
888-659-3727 is the toll-free number. Give us a call. Our lines are open. Believe it or not, we have open lines, so feel free to call. Joe, so my sound is coming through both channels to you, right?
Yeah, sounds great. Sounds. It was so good, I didn't even notice it.
Yeah, I'm looking at my levels here. And it's funny for the main level. It seems to be coming through both channels, but one level in the main audio is only coming through one. So I don't know. It's obviously not making a difference. But spend some time on fixing that today. All right, let's take a call. Hey, you're on the air.
James from Delaware.
Hey, James, how are you?
I'm back. How you guys doing?
What's happening, my man?
Hey, listen, the doc couldn't have said it better, and neither could you guys. And I just wanted to add that the killer of complacency is competition. And, you know, this saying goes true for, you know, the YouTubers in the hair industry. You know, they've set a standard that is unimaginable now. You know, I look at all of these YouTube videos, and I see how, like, there was one particular YouTuber that you guys referenced had multiple, you know, hair transplants, but didn't state it. And, you know, most of his YouTube videos, you know, he alluded that, you know, one, maybe two, when, you know, a lot of these YouTubers and these influencers have multiple, you know, hair transplants to get the look that they want. One other thing is, you know, personally me, I'm still shopping around, and damn it, I want a FUT, man. If you can tell these doctors to bring back the FUT, please, if there's any doctors here listening, I want a FUT. And one of the reasons is because you guys hit it out the park, you know?
Well, here's the thing. The good news is there are still doctors.
plenty.
Where are you calling from again? You said
Delaware.
I mean, there are doctors within driving distance that do FUT as well. You can go to Bernstein Medical. If you're an appropriate candidate for FUT, I mean, these guys are the masters. There are other doctors. I know there's Dr. Doran in New York. There is who else?
Cooley
Joe?
in Charlotte.
Yeah, Cooley in Charlotte.
Yeah, Dr. Cooley in Charlotte. Dr. What's his name in Connecticut?
Dr. Scott Bowden.
Scott Bowden.
He's still doing.
He's really good.
He's still doing strip. I mean, that's a great. That's all relatively close.
Okay. Well, you know, one of the things that has drawn me to strip, of course, I had one before. I like the results, you know, as age progresses. And, you know, again, you guys couldn't knock it out of the park even more because as you get older, you know, you're going to lose. You're going to lose. And that's the whole thing. That's the reality of, you know, hair loss. And when these doctors do the FUEs, yeah, they're great. You know, they don't have the linear scar, but they're not in the sweet spot. And doctors are not advertising that. And you guys are so truthful. And, you know, I've learned so much information about the hair transplant and just the industry itself. They're outside of the sweet spot, you know, and you're going to lose.
Well, and that's I'm glad that you were able to take that away from the show, and it's incredibly important. It's not as though FUE isn't a great procedure, because it is, and I would say, and Joe would probably agree, that I was its biggest advocate. I pushed for this procedure to be performed in North America and Europe. No one wanted to listen to me, but when I introduced the Woods technique to these guys, in a million years, I never thought that there would be a few who would want to take a chokehold, rename it in some cases, whatever, and then essentially make it the premier or the main procedure in this field. I always thought it would be a great adjunct procedure. I always believed that for those who are stripped out, for those who really wanted to move as much hair as possible, to give a guy an extra 2, 3, even 4,000 grafts that they couldn't get out of a strip, then what a great, concept and what a great procedure. That's how I thought they were going to evolve this. But no. A couple of guys were just like, you know what? We could really emphasize the fact that we're not going to leave any linear scars. And this is a, in quotes, scarless procedure. And everyone jumped on board, and now the industry is really a mess. And these young guys especially, they do not have a fighting chance. They have no idea what they've already stepped into. I had a guy that contacted me because of a post that I put up on Instagram. And I said, basically I was saying, look, if you want a good 10 years out of your hair transplant and you prepared for this and you're uninterested in having a linear scar, then, and as long as you are fully informed, then moving forward is fine with FUE, as long as the patient's informed. This guy panicked and said, I just had my FUE 3 years ago. What makes you think it's only going to last 10 years? And I explained, listen, there's no expiration date on your hair transplant. But you definitely have to have medication for a lifetime.
Spiral.
Yeah, for sure. And there's a greater chance that hair that was moved outside of your sweet spot is going to miniaturize in time. That's all these kids have to understand. But I think it's very unfair that that's not promoted, that's not advertised, or I should say that physicians and consultants are not advising patients of this reality.
You said something that's really important. When a medical professional or even a consultant leaves out information, that's borderline misinformation. The miss means it's not there. If I'm going to, and again, you guys posted something and people are not looking at the reality that this is surgery. So in surgery, personally, I want all of my options, if not available, at least inform me of all of the options and all of, the situations that may or may not arise from this procedure. But it's surgery.
It is surgery. And I love when these kids say, and they write me, on my, and again, I guess my Instagram has been growing, so I'm getting many, many more comments and DMs. They are so angry and rageful. They're like, you don't know what you're talking about. FUT is archaic. FUE is state-of-the-art. And I'm like, I don't say it, I try to be nice to these guys, but I want to say, listen, mother effers. This thing, FUE, is over 25 years old. Actually older. It was originally done in the late 1930s. Not much has changed. This is not a new technique. And when I hear these facial plastic surgeons saying that this is a new scarless technique, not only do I want to throw up, I want to contact their state medical boards and tell them, listen, you got a guy out there that's becoming an influencer online that is completely misleading patients. And essentially, I think that's tantamount to malpractice.
Yeah. One of the things that I'm doing is I'm studying. And, every time I get on different platforms, such as yours, and I look at the influencers, I learn something new. And it just adds to my time to study. When I learn something new, it's like, I thought I was ready. I'm not. Let me study a little bit more. Let me look around a little bit more. Now, as time progresses, I am going to lose, and I understand that. But I think weighing the loss of hair that I'm going to have versus the knowledge that I'll get, they say in carpentry, measure twice, cut once.
Right.
So I'd rather do that than, cut once and measure twice or, because the donor is limited. It's very limited. And you go to the wrong procedure. Like, I've seen influencers, not even influencers, just young people who have been butchered. A lot of females.
Dude, I saw this.
A lot of males.
I saw this young black kid who, and the reason I even mention the fact that he's black is there seems to be a real trend with African Americans, Hispanic kids, dark-skinned guys getting beard hair transplants in Turkey. Huge trend. It's fucking insane. This guy has no discernible scalp hair loss at this stage. He went in, he had a beard transplant. I'm looking at the work. I'm like, it's possible it's not going to grow in well. It's possible it will. I do know that with Afrocentric hair, sometimes there's more of a problem when it's placed in the beard. I don't know if you agree with that, Joe, but some of the complications that I've seen have been horrific. This guy's out there just talking about his procedure, which is fine. I understand he's trying to share his experiences. He's building this brand online. But then when you read all the comments, people are like, oh, yeah, I need that done. I'd like to get this done. How much did it cost, this and that? And he's explaining that he didn't have FUE. He had a DHI procedure. And I'm just like, the record scratches, man. I'm just like, and I want to write on this guy's thing, but I don't have time. Just like, listen, dude, you had an FUE procedure. That's what you had done. The grafts were extracted via FUE. I don't know how they extracted, what device they used, but it was FUE. If they chose to use implanters, then it could be considered DHI. DHI is nothing but a marketing term for stick and place using implanter pens. And the fact that there seems to be some sort of differential made online, like there are 3 or 4 different types of hair transplant procedures, is insane to me, and it's so angering. So I just try to get zen about it, smoke a little dope, and then I watch television. Was that?
Yeah.
I made a video about that, breaking down the 4 types of FUE surgery, and at the end, obviously, it's all FUE.
Right.
There's DHI, whatever. Like Spencer said, it's basically stick in place with pins. There's sapphire FUE. There's robotic FUE, and there's I think I classify as device FUE, which includes robots or the robot artists, and then devices, and then manual FUE, which is literally manual, holding a punch between forefinger and thumb and rotating thusly. But the thing about what you're talking about before with the misinformation, this goes back to what I was talking about with Dr. Shafu on the previous call. It's not necessarily misinformation deliberately if they believe it themselves. And you got two problems with these influencers. You've got a lack of experience and understanding of what they're actually talking about, and then you have the financial motivation, which is why they're being a YouTuber to begin with. They're not online to share their experience. Because if they were, then thanks for videos. Bye.
I'm going to make a semantics
but they keep going.
Correction here. It is misinformation. It's not disinformation. They're not purposely giving you misinformation.
There you go. Okay, so disinformation is considered to be deliberate?
Yes.
Okay. I wasn't sure about the semantics there, so thank you. But yeah, so it's a matter of being ill-informed on their part.
There you go.
And there's the financial motivation. Because if it was just sharing their experience, they'd have their videos up to month 12 or whatever, and they'd go away. But that's not what it's about. And what Spencer was talking about with beard hair transplants, that's becoming an epidemic in my mind.
In the black community, it is insane. I can't even believe these cats.
Not just in the black community. Like okay, so let's drop a name here. Look at Matt Dominance. He had a beard hair transplant. I don't think he talked about it until afterwards. Like I don't follow every video that he puts out, but I remember him announcing that he had a beard transplant, and it was like he announced it after he had it, and then he's showing the footage of when he had the procedure. The kid, okay, number one, I think he's still under 25, not sure, or getting to be about there. I didn't have a full beard until I was about 32. Like I could grow a beard, but it was still patchy on either side of my lips. I couldn't get the size to grow up and meet my mustache. So there are these 2 gaps. Looking at me now, it's easy to see, oh, they filled in. Yeah, that's not a problem. And that happened when I was about 31, 32. It started to fill in. So there's a chance that it was needless just on that level and a waste of grafts. But then there's the other issue of he doesn't have a whole lot of donor hair left to begin with. He's already a repair patient, and arguably he's going to need more hair in the future, but he decided to put X number of grafts into his beard because he couldn't wait to have a good beard. Like, what the hell? Like, what? I remember seeing that, and I was just like scratching my head, and I feel bad that he made that decision because I feel it was premature, and it might wind up being an issue for him in the future. But that kind of approach, that kind of nonchalant approach or attitude towards beard hair transplantation, I feel is pushing far too many people, whether it be in the Black community or Hispanic community or not. Anyone watching those are more encouraged to get beard hair transplants because they're young, their beards haven't filled in properly yet, they haven't given it enough time to actually do what it's going to do, and they're robbing Peter to pay Paul from the future because they may need that hair when their crown starts to thin out or when their hairline starts to recede or whatever.
When you go when you see these Turkish hair transplant clinics, mills come through your feed, and you see the outlines in the white chalk, in the white Sharpie.
it's fitting
of
the white
scalp,
chalk.
the scalp and the beard, and then guys like their fucking thumbs up. Oh, sorry, Joe. Cut that out. Thumbs up.
It's okay.
You're like, these poor schmucks have no idea what they're in for. They have right now. They are, and it may turn out great for a short period of time. It's unlikely. Most of I would say that most of the cases that you see initially, where they have, the outlines drawn and they have images, you're not going to see them again online. Not going to happen.
Mm-mm.
But you'll see a few, and they're going to turn out great. And then by the time they reach 35, things are not going to be so great. All of a sudden, they're going to be laser resurfacing for their face, and they're going to trying to figure out what are they going to do about all the scarring on their back of their head because they lost all the rest of their hair.
One of the things that I would like to also talk to you guys about, and you guys made a great segue, there are a lot of influencers, okay, giving out advice about hair transplants and requesting payment. For the public, any advice in regards to anything medical is medical advice. You must be licensed to give medical advice. I'd rather pay a doctor $100 and go and sit down with a hair transplant specialist who's going to give me advice than do it online or get information or advice from a YouTuber, an influencer who may have had a hair transplant. They may have even had a successful hair transplant, but it's case by case.
Mm-hmm. Listen, man, all I can say is, and Joe is aware of this because he's been approached countless times. I still, after all these years, people want to pay for my time to advise them one-on-one. They used to do it on the radio. I used to actually pick up calls when I was on the radio after the show for an hour to give people free advice. And then they're like, well, can I pay you for your time? No. That's, in my view, that is bordering illegal.
Correct.
Number one. But more importantly, I'm not a doctor. I'm not here to give you medical advice. I can only speak from my experience in the field. And listen, at the time I wrote the book on the subject, I did my due diligence in a way that no one else had. And that book essentially shaped the field, at least for a decade, meaning that physicians who got a hold of the book, consumers who read the book thoroughly, who understood what to look for in a surgeon, that really forced the industry to evolve. So instead of 11 physicians who were doing pure follicular unit transplantation using the right team and stereomicroscopic dissection, everyone started to do it because they needed to do that in order to compete. That's how I kind of got my understanding of the field and how I became an expert, because I did my due diligence at the beginning. But I would still always tell people, look, man, I'm not a doctor. Take this information that I'm giving you and bring it to your doctor and talk to your doctor about any final decisions that you make. For me to go out there and give somebody a private consultation, I mean, I find that to be repugnant. And I don't care how broke. Well, I haven't been broke in a long time, but and to be candid, but if God forbid something happened, I wouldn't do that. I'd find another way to earn money. I just find it to be very irresponsible.
One last thing that I want to address, and you guys show is the best platform ever, is in the African American community. I am seeing a trend of, and this is my opinion.
Wait a second. Why did you say you just pulled a Biden? I couldn't understand what you said.
I said, in the African American community, what I am seeing with hair transplants is that it seems either they're donor or they're crown, meaning they either get good results and get a butchered, donor area, or they spare their donor but they get sparse results. I'm seeing it more and more, and I think that it should be addressed before it becomes an epidemic.
I would say that it's too late. It already is an epidemic, but it should certainly be addressed. Yeah. With that said, I'm going to say that I think that guys, dark skin, Afrocentric hair, being whether they're African American or they're Hispanic, they can get away with actually having less hair moved to give themselves a really good framing of the face and to look like they have a full head of hair. So in a way, if they go to the right physician, the right team, they can make even better candidates. I mean, take out of the equation possible keloid scarring and stuff like that. But just as far as the aesthetics of a hair transplant, and also the fact that you can kind of make you could have a sharper line in the hairline. It doesn't have to be as staggered. There's a lot of benefits. The hair kind of curls on itself. So, less hair needs to be moved. They could make really great candidates for hair transplant surgery. But with that said, I'm seeing a lot of shitty work online, man. A lot of guys are regretting it already. So there's one cat that decided to go on Harry's channel and shave his head. He should never have had a hair transplant to begin with.
Wow.
And now he's just kind of left with scars. Now, he was brave. And honestly, he looks really good with a shaved head. So that should have been his first line of attack.
And what Spencer was saying about how with African Americans, the way that the hair grows, it makes them really good candidates in a lot of cases. You don't have to move as much hair. The problem I'm seeing is that a lot of these clinics don't understand the advantages of that kind of hair, and they'll make an estimate. They'll make an assessment and a recommendation for surgery for an equal number of grafts that would have been recommended for a non-African American with straighter hair, like Caucasian or Hispanic. And so you'll see these black guys going to Turkey and they'll have a 5,000 grafts surgery for a Norwood 4 or Norwood 3 pattern hair loss, which is way too much hair. You can actually get away with about half of that on a Norwood 4, and it would look fantastic. Coverage, density, the whole 9 yards. And it's just another example of inexperience, amateur clinics not knowing what they're doing. So you increase the risk of follicular holocaust in the donor zone because of the increased transection rates and the need for a larger punch, and you're wasting more hair in an area where otherwise you could get away with half the amount of hair moved and actually achieve the desired result. So it's just another example of how the industry itself is going down the toilet, and it's just getting more and more difficult for me to hold back, honestly, on a lot of what I'm seeing. I'm actually not holding back too much anymore.
But you said something interesting. You said something interesting about amateur clinics. To my knowledge, and based on being in the industry for so long, I mean, I don't even, if there's 150, not even 200, maybe 150 non-amateur clinics in the entire world, not just the U.S.
At this point. Yeah.
And in Turkey, I would say there are less than 10.
Okay.
What would you
potentially.
say?
Yeah.
Basically about
you're in the ballpark. I agree.
8 to 10 maybe, who are actually performing a hair transplant surgery to any real state-of-the-art standards or to any real, standard of care that, a patient should be looking for. Everything else, man, you're taking your life in your hands. I have spoken with and I've heard from people coming back from overseas with MRSA, with other bacterial infections that took doctors here a month to figure out what it even was. No one even thinks about that. They're like, oh, I had a limo driver and they took me out to eat and all this stuff. Meanwhile, they're getting some bizarre infection that's not even happening here in the United States and no one knows how to fucking treat it. Sorry, Joe.
Could you guys please do a video, okay, addressing the medical standards in each area that offers hair transplants? Turkey is one. Very relaxed medical standards. Europe, Brussels, the U.S. One of the things that has had me do even more research is finding out that each area, each country that offers hair transplants, they all have totally different medical standards. Some are relaxed, some are not so relaxed, some are very strict. And you're talking about relaxed in an environment where instruments need to be sterilized, certain procedures need to be, training. What happens when certain scenarios occur.
Even beyond that, let's say the clinic is, certified as an outpatient ambulatory clinic, and has everything that you need: crash carts, the right methods of sterilization,
protocols.
all the above. What was that?
Mm-hmm. Protocols, yeah.
Protocols, yes, that's a good word. But if you crash, and maybe they save your life, and then all of a sudden you're picked up in a fucking rickshaw to be taken to the hospital, that's not good.
Right. Right.
And that's a possibility when you go to these places.
Right.
Yeah. Sorry, Joe.
It's scary, and this is what I mean in regards to misinformation. It's the information that needs to be commonly and abruptly broadcasted. These have serious and dire consequences.
I made myself laugh with that rickshaw joke, but I'm telling you, man, you don't know what you're getting. The facility can be great, state of the art, but as soon as you have a heart attack,
yeah,
you have the Keystone Cops taking you to the hospital, and who knows? You're waiting there with people who have malaria or whatever.
Yeah.
So
the biggest thing that I just want to leave with your audience is you never know. I'd rather know than not know. I'd rather, one of the things stateside, I know that the medical procedures and the standards are way more stricter. Is it more money? Yes, but that's what you pay for, It's like a 5-year-old's painting versus a Picasso. You know what I mean? If you want a Picasso, you're going to have to pay for a Picasso. If you want a 5-year-old's painting, well, you can go to preschool.
Probably don't want to compare Picasso's work to a hair transplant, but I know what you're trying to say.
The aesthetics.
We understand the analogy.
Yeah.
So and that's the main takeaway. And I'm still looking, and you guys' platform is a lexicon of information.
Dude, you are.
Every time I listen, I get a new light bulb goes off. So thank you.
Well, thank you for saying that, and we really appreciate
awesome
your patronage. And we want more listeners to get it like you do. It's not. We have no skin in the game. There's nothing in it for us, to tell you the truth. Honestly, nothing. It has actually been a very difficult thing for me to do all these years and deal with as far as providing you guys with the information you need to make informed decisions. There are people in this industry that have gotten very upset because of their fear of me interfering and getting in between them and their money. And Joe and I have dealt with a lot of shit. I mean, Joe hasn't dealt with as much as I have, let's be honest. But it has not been easy to get out there and tell you guys the truth. So I'm glad you're a guy that gets it.
Thank you, and you guys keep doing what you're doing.
All right, brother. You take care. Thanks you for the call. Great call.
All right.
Take
Thanks.
care. Bye-bye.
Bye-bye.
Phone number, 888-659-3727. You get a call like that, you really start to you recognize that you're doing something good in this world.
It feels good. It feels good. He's a motivational caller.
100%. I was just about to take another call, but they hung up. So, okay, we got another one on the line. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from?
Hey, this is Steve. How's it going, Spencer?
Steve, what's happening? Where are you calling from?
Actually, right now I'm calling from Mexico. I'm on vacation.
Good for you.
Right on, Steve.
I'm calling. Hey, Joe, how's it going? I'm calling because 1.5 years ago I had a procedure done with Dr. Yaker, and it turned out excellent. It just looks undetectable. That's how good it is.
He's a great doctor, man. Good guy too.
Yeah. And it's just so funny because earlier one of your callers was talking to you about how younger guys want to have lower hairlines. I was one of those guys. I wanted to have a lower one too. But, Dr. Yaker, he explained me all the reasons. He said, hey, look, it's not a good idea. And instead, he really focused on my temple points to, frame the face.
Yeah, it's huge.
And that made like a world of a difference because, in that case, you don't even really have to lower the hairline because since the temple points are more visible, it almost looks as if your hairline is a bit lower.
Absolutely.
So,
well said.
Turned out
well said.
Temple points, even if a guy decides, I don't want to get a full transplant, I'm significantly bald, but I have enough hair to, maybe get a transplant and create more appropriate temple points or, kind of reverse that process. If they decide to wear hair in the future, it gives them a fighting chance to look like they have 100% natural hair in their head. Those temporal points are so vitally important. They're the biggest giveaway for a hair transplant and also a hair piece.
Yeah, 100%.
Absolutely, yeah.
100%.
So, yeah, guys, I can't keep this too long because, I'm on my data roaming right now. But I just want to let you guys know, shout out to Dr. Yaker. He's the man. He also did it in one go, which is great. He said you might possibly need a touch-up, but wasn't necessary. I had like a Norwood 2.5 bordering a 3, and, he just filled in the temple points and made it look all great. So
I'm really happy
I would highly recommend.
Nice.
Thank you. Thank you.
All right.
And, just to all the listeners, if you're in Texas, go to Yaker. He'll know what to do. He'll take care of you. And, all right, you guys have a good one.
Congratulations, man. I'm sure the check is in the mail.
Buddy. Enjoy Mexico.
I'm just kidding.
All right. You have a good one.
Take it easy.
All right. Bye-bye.
Take care.
888-659-3727. No, Yaker he's good at what he does. He's young. He's got a lot of energy.
Yeah. One of the future leaders of the industry,
Absolutely.
like I say.
And he also happens to be proud member of the tribe. So
the proud tribe member, exactly. And one of the things I do like about him, and it's funny that the caller focused on that, are his temple points. He's one of those few doctors that understands temple points and does them well. I always love looking at his temple point work. So good call. Thanks for calling in.
You ever think you'd be saying that when you were 20 years old, that you love looking at someone's temple point work?
No, I didn't. Fuck. I was in a good mood.
So
for these nice
nerdy,
calls,
dude.
And now I feel like a total loser.
888-659-3727. What a hair nerd. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from? Hey, caller.
Hello.
We hear you.
We hear you.
Speak up.
Nope.
I'm going to hang up. 5, 4, 3, 2, 1. Good night. Phone number 888-659-3727. We have about 17 minutes left for the broadcast. If someone wants to call in, be more than happy to take your call. Or we will end the show early. Anything in the chat going on, Joe, that I should know about?
Jawade Mohammed says, I get it with heart-filled eyes, smiley face. This industry has exploded with influencers. Yep, exactly. Looks like he's listening to the previous part of the broadcast.
But I find it interesting.
Neil says...
Go ahead.
I was going to say, Neil says, I go on r/hair transplants, which is a subreddit, and see all the botched hair transplants. Never take advice from Reddit. That's why I go on Reddit, just to see all the botched hair transplants. And I'm continuing to be amazed and shocked with what I'm seeing on Reddit. Go
to these forums, man. It's always been that way, man.
Oh, no. This is worse.
Is it really?
This is worse than no. Oh yeah.
Okay. Full disclosure. Yeah. When people talk about the influencers online and you guys name some names like this guy Matt Dominance and shit like that. I've watched a few of his videos, and I know that sounds like, oh yeah, sure, you only watch a few of his videos. I really only have. I let everyone else complain about it or talk about it. Some people really think he's a great guy. I don't know it. The stuff that I've watched from him, he seems like a very nice person who had a bad hair transplant at some point. Mm-hmm. That's all I know. But all the stuff that's going on Reddit, whatever it is, people send me links. I look at it for a second. I'm just like, look, nothing's going to change. We have to change it ourselves. We can't force these guys to listen to us. We can't force these people to not make life-changing, disastrous mistakes. All we can do is speak to the people who are willing to listen to us. And if that's $2,000 a week or $3,000 a week, great. Then we help those people.
Mm-hmm.
That's how I look at it. I'm not banging my head against the wall anymore.
Well, for me, it's not about banging my head against the wall. It's just I try to not think about this too much, but when I try to stop thinking about it too much, I start thinking about it more, and especially. Like I've been motivated recently to get more involved with some of these people that are asking for opinions, and I'm starting to give it. And my attitude and approach to people sharing their results has changed, where I used to think they've been through it already.
Oh, how nice. They're sharing their results and helping people. That's what I used to think.
Yeah. It used to be a position of mine where they're sharing their results and they're happy with it and they're just looking for validation. And I'm to the point now where I think that validation that was fake by a lot of people just being nice, I honestly think that that's contributed to some of this problem that we've got, where too many guys are being non-critical or uncritical about results that would, if they're being honest, would be labeled as horrendous.
So you're saying that these guys who are on Reddit are complicit in the degradation and the devolution of this field?
Reddit is not part of the problem. Reddit is a symptom of the problem. The people that are validating these horrible results are not Reddit people. They're everywhere.
I see.
Forums, YouTube, Reddit, insert platform here.
Stay off the forums.
It's responsible. Stay off of, yeah. And it's, like I said, I used to not speak up because I didn't want to hurt feelings. But I realize now that by not hurting feelings, everyone else looks at it as being, oh, well, it must be okay because people are saying it's okay.
Yeah.
And it validates that kind of approach, that kind of hair transplant, that kind of result. And I'm done validating that kind of stuff. I'm
no one ever cares about hurting my feelings. Let's take a call. See who this is. Hey, you're on the air. Who's this and where are you calling from?
Hi there. I'm Alex. I'm from the UK.
Alex from the UK. What's
Hello,
happening,
Alex.
man?
Hi there. I just wanted to sort of pose a hypothetical question to you both. If you were looking back at your experience with hair loss and how you treated it, if you could go back to the age at which you started experiencing hair loss and given everything you've both been through, what would you change and how would you approach it if you could do so from the beginning? You know, would there be an ideal optical treatment management plan that you'd take?
That's a good question, and Joe has a longer answer than I have. Here's my answer. I wish I didn't suffer and waste so many days and months and years of my life suffering and drinking myself to sleep and, quelling my anxiety with sex and booze and I'm sorry, that's the wrong show. But
I was going to say.
I honestly would not have done anything different in my case because while I wasted a lot of time at the beginning as far as buying bogus products and services, flying to different parts of the country to try nonsense, putting all kinds of crap on my head, I somehow avoided some major mistakes. One was I almost had a hairpiece sewn in my head. I didn't know it was a hairpiece at the time. That was one. That was being done in the late 80s. Another, I almost had a hair transplant with Dr. Norman Orenreich, who would have destroyed my life. He was willing to put 4 millimeter plugs in my hairline that was just starting to recede slightly, and I chose to step away from that. The only thing that I would have done is gotten on finasteride a little earlier because I was going to a doctor. His name is Dr. Leuenberg, who was selling the Leuenberg formula, who when I said, and I showed him this article from the New York Times, that I'm considering doing this, the next week when I went to him for my product, I saw propaganda, in my view, anti-finasteride propaganda all over his office. He told me that this drug would feminize me. I cannot take this drug. It's going to be very dangerous. And I wasted about 6 months before I made the decision to take the drug. So that's really my only major mistake. So I would not have done anything differently. I feel very fortunate that I got on the drug earlier than anybody else. One of the first people to take it for male pattern hair loss outside of its clinical trials. And that I was able to step back, not get a wig sewn into my head or have my head shaved and have a wig put on my head or anything, even though our incel friends think differently, by the way. But yeah, so to answer your question, for me, I felt that I did everything, luckily, the right way. And I wouldn't change a thing except for the level of suffering and anxiety.
Yeah.
Joe?
I'll remind you that Spencer claimed that he has the short answer between the two of us.
Oh, good one.
Wow.
Good one, Joe. Go ahead.
Okay. So my answer to that question is, it's the same as I've always said over the years, is if I knew then what I know now, I wouldn't have a hair transplant. Full stop. If I could change anything now, I wouldn't change anything. It's kind of a strange answer, but if I were 22 years old, about to have my first hair transplant, and 2023 me showed up and told me what I would be in for as far as the 2 bad results, the 9 years of living with ant legs sticking out of my forehead, the 7 subsequent procedures, like I'd be like, no way. What I would have done is I would have started to take Proscar because Propecia wasn't available at the time. Proscar had just become available that year, but I didn't know about it. I didn't know about Propecia even when it first came out, or I might have heard about it and dismissed it because I was very anti-hair restoration of any sort. I was bitter about the whole situation. I wasn't looking for help. I was just looking to hide it. That's all I cared about. That's why I became addicted to good-looking hair, which is the name brand of a hairspray that was the predecessor of Topic and Dermatch. It was a pressurized can of, it was like a spray paint. GLH hair in a can was how it was marketed or how it was referred to, and it was sold on late night television by a very famous North American marketer named Ron Popeil, responsible for a lot of actual popular products in the 80s and 90s. But yeah, so that was my focus. And had I known about finasteride and I knew that the efficacy, the result that it would have for me, I wouldn't be sitting here today, because it would have stopped my hair loss, at least prevented it from getting to, I would imagine, I'd probably be a Norwood 3, maybe a 3V at this point. It would have saved a lot of my hair. And that's just based on my experience after I'd lost all my hair, where I had a little bit in the back and a little bit on the sides. The parietal humps were still there, or not quite there, but it maintained, and it's still maintaining to this day, 20 years later. But surgery, that's a different story. Again, had I known then, I wouldn't have done it. What I know now, if I could go back in time to change it, I wouldn't change it, because it did make me, I feel, a stronger person, where I can deal with adversity in a way that I couldn't have before I had surgery. So the negatives I went through, having to deal with people laughing at me, having to deal with knowing that people were whispering behind me and people confronting me about it in front of others in groups. I still get butterflies when I think about it. But when I realize how it's kind of hardened me to those kinds of situations, it's allowed me to be a person that can speak in public. I don't get intimidated when I'm confronted in front of people now, not like I did when I was younger, and I think those experiences helped with that. And I think also coming out on the other side with a positive repair story also helped with that as well. So it's allowed me to reflect, on the bad days and the bad experiences, and come out on the other side not just with a better outlook on my hair, but it has allowed me to be, I guess, repaired as a person in how I deal with life, if that makes sense.
Absolutely.
Yeah. Yeah. So I think it was still a shorter answer than Spencer's, and I hope I answered your question.
It was not shorter. I timed it, man. It was like a minute and a half longer. Come on.
You did not.
I mean, the reason I asked that question is because, like Spencer, I feel as though I've been very lucky in that I had access to good information early on. I started experiencing hair loss at quite an early age. It was maybe about 18 years old. And by the time I was maybe about 19, 20, I had started using finasteride. And thankfully, I had very positive results from finasteride. I'm now in my late 20s. And I've more or less just maintained where I was at. I'm probably like a Norwood 2, but no one would be able to tell that I have hair loss. The reason I got on it is because the males in my family, like my brothers, my father, they've all had hair loss. And when I compare myself to my brothers and my cousins who haven't been using finasteride, they're all now around Norwood 3, Norwood 4. So in that sense, I've been very lucky in that I've had a good response to finasteride and got on it early. But I'm sort of looking to the future now and anticipating that there is probably going to be further hair loss at some point. And I'm sort of just trying to learn early on how I should manage that, whether I should just keep on the drug as long as I can and delay a hair transplant as long as I can.
I mean,
I'm not
you're
using
Norwood
to
too.
exaggerate.
You don't have hair loss.
Yeah, you're very lucky.
You win.
Yeah, at this point, and the fact that you've been able to maintain it for a decade, and those are very important years of your life. I mean, people don't fully grasp the power of, first of all, how effective this drug really is. A lot of people, they get on it maybe a little later than they should have, and they don't see a tremendous amount of regrowth, and in their minds, they don't think it's working. But if they would have stayed on the drug, especially if they didn't have any adverse side effects, which most people do not, if they just would have waited, they realize, and everyone sees, like, all of a sudden the friends who were not losing hair before, when they started, are now dealing with hair loss, and the guys that started finasteride earlier are the guys that somehow maintain their hair. And it's almost like a mystery. I have a buddy of mine who many years ago, and he's dealt with some real significant health issues, so he doesn't even think about this. But there was a time when he asked me, I had already been on the drug for maybe 5 years, and he knew my story and everything. And he said, I think I'm starting to lose hair, but, I'm probably not going to do anything about it right now until I need to. And I said, well, look, man, I'm not telling you to do what to do, but now's the time. You still got a lot of hair in your head, and early intervention is the key. So you don't wait until you lost your hair to take this medication. You start early. He chose not to do it. He lost a lot of hair. Both of his younger brothers contacted me, really on the cusp of their hair loss. And these guys are now in their 40s, and they have full heads of hair.
Yeah,
so
I think that was one of the most important messages I took from your writings and your podcasts, is that finasteride, whilst it's quite mediocre at regaining hair, its efficacy for maintaining hair is extremely good. So the earlier you get on it, the better.
That's correct. And a lot of people don't understand. They don't get that takeaway. They don't understand it fully. And like when Dr. Shafu called in, he said, that there are guys who like saying they don't want to take a pill. They just want to get surgery. That doesn't work. Hair loss is a progressive disease. Your hair follicles, your organs are essentially dying. They're miniaturizing because of dehydrated testosterone and other, inflammatory issues, and mostly DHT from what we understand right now. And you need to be on medication. If you want to fight this battle successfully and maintain your hair, you need to be on medical therapy. End of subject. It's the only thing that's going to help you. You need to lower your DHT. So you are lucky, man. And, I'm glad you're still listening to the broadcast, but it sounds like, at least at this point, you won. You are winning as of now.
Sure. Yeah, I do feel that way. I feel as though I'm in a good position. I just my personality is such that I always look to the future and see how I should manage it when the time comes, but hopefully that won't be for a while.
Well, here's the thing. That is a part of a lot of people's personality. It's part of my personality for many years. But you need to just control what you can control, focus on enjoying the day. We spend a lot of time in our lives thinking about what might happen instead of enjoying the moments that we have right now. And that fucks up our day. If you're worried about thinking about what might happen, you can't really enjoy the fact that you're walking around with a full head of hair right now and your health.
True.
And that's not atypical. That's the way most people operate. And it sucks. And, it's taken me a lot of work to try to avoid living my life that way. And I still can't completely. But I would say for the most part, I'm much better at it. Like, when I get off the air, I'm not going to think about this show or the fact that Joe's story was so long. I'm not going to think about that. Joe. But no, really, man, you are in a good position. You're still young. You saved your hair for a decade, man. You can go for another decade, no problem. Or longer. All right, man?
All right. Thanks very much, and I appreciate all the good information you guys put out. It's been very helpful for me.
Okay, I'm really glad.
You.
And
appreciate your call.
Thank you for calling, and try not to think about it. You're doing well.
Will do.
Okay,
thanks
care.
a lot.
Bye-bye. All right, there's a guy holding on. We could do like a 5-minute call because we started about 5 minutes late. You good with that, Joe?
Let's do that. But I want to say something.
Yes, please.
That last caller is the reason why we do this. One of the reasons why we do this, because he won.
Yes, he won.
He's a Norwood 2.
Yeah.
But he sees himself as a hair loss sufferer and is talking about surgery. And this is something, he reminds me of a guy I met many years ago in London when I was there doing consultations. I'll never forget this guy. And it was a very valuable lesson for me early in my career.
Not the London consultation story again.
Oh, it's the London consultation story again. No, this guy showed up. He would write to me, when I was at the clinic. He would post online, and he was just another one of the guys dealing with hair loss. And he showed up to this consultation, and he looked like he had so much hair. He looked like a hobbit.
You told me that story.
Like hair, like juvenile hairline, like you've never seen before. And not that this guy, the last caller, is the same way. He's a Norwood 2. But in his mind, he was losing his hair.
Yeah.
And he'll say something. He said something I will never forget, and it freaked me out when he said this, because I was like, what am I dealing with here? He said to me, the reason why he's interested in hair transplant surgery is because eventually he's afraid that he'll lose his hair, and he hopes that his outcome is half as good as mine. I was almost a Norwood 7.
Yeah.
And this Norwood -5 was looking at my result as being enviable, something that he would aspire to achieve. And I was almost a Norwood 7 repair patient, and it scrambled my brains trying to wrap my head around this. And then I realized, and then over time, I understood more about the psyche of hair transplant patients.
Yes, hair
and
erection.
This last caller reminded me of this guy, and I'm not saying that his concerns are unfounded or anything. I'm not comparing him to that other guy, but it just reminded me of that. And this guy is a Norwood 2. He saved his hair, thank God, through the use of medication. Well done. I love hearing stories like that. They're very inspiring. But he's wondering about surgery, wanted our input on it, and he doesn't need surgery if he's a Norwood 2.
Well, and I completely understand your point, but I also understand that a lot of people, especially when you've already seen it start and you're on medication and you're on the internet and you're reading people's stories and their failures and people saying it only lasts 5 years or whatever, like there's some sort of switch or expiration date in medication.
Yeah.
And I've watched people over the years, and I've even been kind of drawn into it. Like, you're just waiting for the other shoe to drop, and how long is this going to last? And it's fucked up, you know? But you can't live that way, because if you do, you're not fully able to appreciate and enjoy what's going on in your life right now. And that's a huge problem. That's a major hurdle for most people to get over, including me. Trust me. I'm as fucked up as everybody else, man. I've just somehow figured out a way to navigate being fucked up and make it work for me.
Language.
Oh, yeah.
Language. Yeah. But
and
I get it. And you are like that. I understand that about you. But this guy, last caller, I appreciate guys like him because it's motivation for us. He has no hair loss issue to speak of if he's truly Norwood 2. He won the fight with medication, yet he's still listening to us and looking to us for guidance in case that other shoe does drop. So I appreciate calls like that. I really do, and I'm glad he called. So, yeah, I just want to say that.
Well, thank you, Joseph. Let's take a call.
Yeah.
Hey, you're on the air.
The shoe does drop. So I appreciate calls.
Dude,
like
you got to turn down your
really
radio or your stereo. I'm sorry, your stereo. Jesus, I'm pulling a Biden.
Thank you, Joseph.
Your computer. Dude, turn down your computer.
Hey, you're on the air. The shoe does drop. So I appreciate calls like that.
Hey, you're on the air. Who's this and where are you calling from?
Hey, can you hear me?
Yes, I can hear you.
Yes.
Great, awesome. Hi, this is Eddie from Houston.
Eddie from
Called a few times in the past.
What's happening, man?
Hey, thanks for taking my call. I've got two questions, but depending on how much time we have, the first one's about the medication. The second one's about doing FUE surgery.
Okay.
So as far as the medication right now, I'm taking 5 milligrams Proscar. I cut that into 4 and just take 3 a week. So that's about 3.75 milligrams. But I'm starting to get a little bit more concerned about the side effects with my libido, just decreased libido and less fluid during ejaculation. I don't get aroused as much as I used to, and I was told that it's possible to take even as little as 0.25 milligrams every other day, or even half a milligram. And I've been on the drug for at least maybe 5-6 years on the brand name Proscar. What would you recommend? Do you think that would be?
I have a question for you. When did you start to notice that you had a lower libido?
Well, I noticed the side effects within 2 months, but now I would say within the past year or less, is just decreasing, and the fluids getting decreased.
How old are you?
I'm in my early 50s.
You're in your early 50s?
Yes.
Okay. Well,
there you go.
I can't say for sure, but your seminal fluid is going to decrease, period.
Regardless.
Yeah. And it is not unusual for your libido to go down in your 50s, separate and apart from finasteride. Now, it doesn't mean that it has to, and it doesn't mean that it's the finasteride. I mean, what else are you doing in your body? What kind of shape are you in?
I'm in good physical shape, lean. I eat pretty well. I don't exercise. I exercise occasionally, but I need to start doing that more often.
If you exercised every day, I can guarantee you that you would raise your testosterone levels. As you are aging and you're losing muscle mass to sarcopenia, even though you think you may not be losing muscle mass, if you're not working out, strength training, you're skinny fat. That's what's happening as you're getting older. And you are not going to have the same libido, guaranteed. You're not going to be producing as much testosterone, guaranteed.
Yeah, I agree. Yeah, I got tested for testosterone levels. It's decent. It's about 400. For my age, it's pretty good.
Yeah.
But somebody was saying that I could go to LabCorp and do a DHT test to see what my levels are at right now. And I think that might be a good option to see where I am, and then I could decrease the medication and then get tested again and see what the results are.
Yeah, listen, if you're convinced that it's the medication after being on it for 5 years, and even given your age, then yeah, that's not a bad idea, and you can definitely test your DHT and see if you're still responding as well on a lower dosage. Again, we're not giving you medical advice. You need to speak to your doctor about this, but that is a possibility. Or you can dedicate yourself to 8 weeks of training and see what happens to your sex drive. Now, this is nobody's business, but I can tell you that there's no doubt in my mind that working out on a consistent basis, and I'm older than you, maintains that not only your ability, but your drive to a pretty ridiculous level.
What are safe levels to decrease the propecia? I mean, where I don't have to see any loss of hair or any concern of loss of hair. Should I just taper to 1 milligram?
Can't answer that question. You've been on the drug for 5 years, taking the same dosage. Any change can change your situation.
Okay.
Now, it's possible that if you titrate very slowly, that you're not going to see a difference. But you don't want to drop from, what you said, you're taking
3.75 milligrams a week.
You're only taking 3.75 milligrams a week.
Yeah, because I'm cutting the Proscar into 4.
Yeah.
and then just taking 3 tablets a week, three
Look,
pieces.
everybody's physiology is different. I don't have a crystal ball. I'm not a doctor. It just seems very unlikely that you're having these adverse side effects from finasteride. But, it's possible, I guess, for sure.
Well, I say that is because I had side effects within 2 months when I started, and I stuck along with it. It was bearable.
But the chances of it increasing its negative effect on you over the past several years, as opposed to it simply being age related, in my opinion, I'm not a doctor, is unlikely. And I think that if you maintain your current regimen and then get into a regular routine of strength training, like Spencer said, give it 8 weeks and see how you feel without changing anything else. And I think it's important to remember that when you're trying to address a physical issue that you can deal with medically, like you're talking about decreasing your intake, I think that it's extremely important to not do to take multiple avenues of correction, because you don't know what's going to actually work. If you start reducing your intake and you start strength training, and your drive comes back, and all the issues that have decreased start to increase again, you don't know what led to that. You don't know if it was your decrease in your intake of finasteride or if it was because of your regular exercise routine. I highly recommend that you stay the course. What the routine that you're doing of cutting your pills the way that you are, but instead of reducing that, just add on the strength training. Find a good personal trainer for motivation. That's what got me back into working out in the first place 12 years ago, and changed my life. Like, I've never been fat. I've never been obese, thank God. I've gotten a little, chunky once in my life, and I corrected that myself. But when I got serious about wanting to change, I was 41 or 40, and it was a life event where it's like, you know what, I need to see what I can do for myself to really improve my physical well-being, and I did, and I learned a lot. And it's not just strength training; it's diet.
Hold on for a second. Do you have a computer on the background?
Yeah, it sounds like it.
Caller?
Who?
Do you have a computer?
No, I don't have anything. No, nothing.
It's a really weird background noise coming.
Double check my stuff. Hold on. Might be.
And some more questions, and then we're going to have to go. Do you have any other health conditions? Any other medications that you're on?
No, I'm in pretty good shape. So I'll do that. I'll get the DHT test. I will exercise and give it a few months, and then see where it goes.
Should exercise anyway, regardless.
It's
not
squats,
give it a few months, just make it a part of your life.
Squats,
you're right,
push-ups, squats, push-ups,
Romanian deadlifts.
Yeah, just basic, basic strength movements. You don't need to do a lot.
Build your legs and core.
Yeah, you need to. You don't even need to join a gym if you don't want to, and you can get all the exercise on YouTube.
Yeah, on postcards,
have access to a pool, swim as much as you can.
Yeah. Do they make a generic version of ProScar?
Why would you switch at this point?
No, I won't. But this is what you were talking about, seeing a doctor. Doctors, I have not met a doctor who knows anything about Propecia or finasteride. They just are clueless. Yes. They don't understand it. I went to a urologist. Yeah. I went to an endocrinologist. I went to a family practitioner. I went to a dermatologist. They're all ignorant.
My urologist, who I had to go to at one point, asked me about topical finasteride. I'm like, Doc, you're a urologist. Why don't you just take finasteride? Well, I've had some patients who believe that they've had, long-term adverse events, and I don't really want to give that a shot. I'm just like, holy shit. So this is a urologist asking me, which is weird, by the way, because I didn't even tell him what I did. So that means he Googled me. But anyway.
Yeah, so my urologist didn't know, so he said there's he didn't really understand the difference between Proscar and no, he told me I could take finasteride. I said, yeah, but I'd rather take Propecia because of the brand name. And he said, well, I can just, like, he prescribes finasteride to people. I say, okay, but who's the manufacturer? He goes, I don't know. I mean, just whatever they offer. It's like, yeah, but they're not the same as if you take a name brand because there could be a lack of consistency. Or you don't know what you're getting when you're doing these generics. They could come from China for all we know.
Right.
So I prefer to take the name brand. But he said there was a name brand, there was a generic version of Proscar. I'm like, I never knew that. So is there such a thing?
Yes.
Yes.
Sure.
5 milligrams of what? What's it called?
It's called finasteride.
Oh, so there's a 5 milligram finasteride and then 1 milligram finasteride.
Correct.
Yes.
Got it. Okay. So the name brand is Proscar for 5 milligrams and Propecia for 1 milligram.
That's right.
Bingo.
So just ask your doctor to say name brand only, and that's how you'll get it.
Yeah. Yeah. But other than that, I don't know who to go to really see what the issue might be. But I took the testosterone test.
You can go to an endocrinologist to have your hormones checked out to get your hormone panels done if you want.
And that was all good. So everything's good. So
I'm saying you said you wanted to get your DHT done.
Yeah, that's the only thing I need to get tested. Nobody ever mentioned that.
Right. So do that, and this way you know. And then I would suggest take Joe's suggestion, getting into the gym or working out in your house. Do strength training. 8 weeks. In 8 weeks, you will see a significant change. I really believe that.
Okay. Sounds good. Yeah, I don't want to take any.
You'll be waking up. You'll be waking up with wood. You'll be good, especially if you already have a testosterone level of what do you say? It's over 400.
Yeah, around 400. Yeah.
Yeah, you should be good. I mean, we don't have a crystal ball, but if you're not exercising at 51, you are. If you're not moving forward, you are moving backwards in double time.
I just remembered. I'm also not in a relationship, so I don't mingle around unless I choose to get married. So I have not been sexually active at all. So I think that might be a part of it too.
That's what massage parlors are for, dude.
Yeah, I know.
All right, buddy. We're gonna go.
All right. Got it. Thanks.
Good luck. Take care.
Thanks for calling.
All right.
Bye-bye.
Thanks. You too, kids. All right, bye-bye.
Doesn't mingle around. I mean, when I told Morty to go to a hooker, he got so offended. Like, no one could take a joke.
Yeah, he's going to clip you at the knees with a baseball bat.
I wasn't even joking, but take it as a joke. Look, these women are doing God's work for a lot of people. That's all I'm saying.
It's a good show.
Very good show.
Good callers.
Yes, and you were excellent today, Joseph. You only yelled at me 3 times about my cursing, and I appreciate that. I'm working on it. How much better was I today?
Much better.
There you go.
Much better. Much improved. The F-bombs didn't fly until near the end.
It's going to take some work, but I'm going to get back to being radio ready.
I believe in you, the little guy. I get you.
I can do it.
You can do it.
All right, guys. Check out Joe Tillman's YouTube channel. Subscribe if you want to know when the show is live. Get notifications when Joe decides to do something unique and interesting on his own, as he always does. Teach a class, talk about something that you guys may be interested in. I am no longer interested in. But he does that very well. That's youtube.com/hair transplant mentor. That's the hair transplant channel. That's youtube.com/hair transplant mentor. Subscribe to the channel, ring the bell to get notifications. And if you're watching the show right now on his channel, like the show, please. Apparently, it helps with something called an algorithm, which I hear is important.
That's what they say. That's what they say.
I know I should be involved in this stuff. I know I should be trying to become an influencer. I thought I was one all these years.
You're the OG. It's okay.
But now it's like...
It works.
All you have to do, apparently, is get yourself online, maybe have a hair transplant, maybe not, Maybe be in fitness. Talk about considering having a hair transplant. Put out a lot of video content, and all of a sudden, you know it all. And people are taking your advice on life-changing matters.
Yeah.
And by the way, someone in the chat, when I was talking about that facial plastic surgeon, it was not Gary Linkoff who I was referring to. It is a local guy here in Los Angeles who is talking a lot about hair transplant surgery, PRP, and exosomes, and essentially saying that this is what he's thinking people are having done or doing, all these celebrities, who I can tell you for a fact, some of the celebrities that he's mentioning have not been doing that. There have been celebrities, without mentioning any names, who contact us for information. And I can tell you, this guy's guesstimates have not been accurate.
I spoke to one last week. I'll tell you about that off air, actually.
Terrific.
It's interesting.
Some of the stupidest people I've ever encountered when it comes to getting medical information.
Yeah.
It's horrendous. And now we got, what's his name, doing who's shilling for the hair club?
Who?
Jeremy Piven.
No.
Let me tell you something. I get these guys, they must have backed up to his house with a truck full of money, man. Good for him.
Yeah.
Good for him.
Oh, I got to look at that now. Oh, my God. Oh, it's just amazing.
I can't blame the guy. It had to be a really great offer. What does he know?
Let's see.
He doesn't know what the F is going on. Yes, he's experienced hair transplant surgery and wearing hair and all that stuff, and he's been dealing with hair loss since a very young age. But what does he really know? He wouldn't have had to go through everything that he went through if he knew anything. You looking?
Here's a video on Vimeo. Video contains advertisement. Comments are disabled. That's never a good sign. They disable comments.
Look, I'm going to, in all fairness, all those companies, Bosley, Hair Club, they've all come a long way.
Yeah.
They really have. True. But when it comes to wearing hair, you don't have to join a club to wear hair well. And I have to say that you're probably, in my view, better off. But listen, if they come to me with a huge offer after they hear me say this, I'll let you guys know if it's big enough, why not? It's time. I have been a really upfront guy for almost 26 years. And what has it gotten me?
Now it's time to screw you over.
Yeah. I have incels saying that I'm wearing a squirrel on my head. All right? Very hurtful. Anyway, just kidding in a way, but really I'm not. I'm kind of kidding. I'm not kidding.
I know, yeah.
I just don't, I don't understand people.
Kidding, not kidding.
People are so mean to each other in this world.
People suck. People suck.
Not all people. You're a good person.
When they're on a keyboard with no repercussions, I'm all right.
All right, guys.
A bad
listen.
hair transplant recipient asked me for opinion.
A what?
Anyway. Unless someone with a bad hair transplant asked me for my opinion, then I'm not such a nice guy.
Here's the problem: if you give him, if you don't tell the truth and he finds out you're not telling the truth, he's going to be pissed off. If you tell him the truth, he's going to hate you too.
Yeah,
that's the way it is.
It's permission to hate me.
Yeah, guys, listen, we're going to go. Thank you for tuning into the broadcast. It's always a pleasure. Until next time, be strong. God bless. Thank you so much for listening. And Morty, if you're listening to this, you're going to be okay. Just get checked out. Have a good night.
Absolutely. Good night.
Thank you very much. I'm sorry for any inconvenience you may have been put to prior to the program, and I'm glad you enjoyed it.